Well, Rob, concerned staff members called 911 yesterday for a welfare check on residents, saying the facility is not doing enough to care for them. And while investigators now look into the handling of the COVID-19 crisis there, one staff member tells me the residents are in danger. The sign on the front lawn of a staff member's home reads, "Our house has COVID-19 because of Life Care Center Elkhorn. The residents are not okay."
But something needs to be done and needs to be done soon, or there's going to start being deaths.
The staff worker doesn't want to reveal her identity for fear of retribution. She tells me she is not a certified nursing assistant, but alleges she's been asked to do a CNA's work because the facility is so short-staffed.
Due to staffs being sick, staff members being ill, home sick, there's people pulling double shifts. So they're exhausted. There's also symptomatic employees that they're not letting go home.
As of Sunday, 22 staff members had tested positive for COVID-19. 30 others were negative. The staffer we spoke with says she initially tested negative last week at the care center, but said she had symptoms, so she went to her own doctor and then tested positive. And prior to getting that second test result, she says she called in sick.
I just felt very bullied to come into work.
The woman also provided text messages she says she exchanged with her supervisors. "It is imperative that we need you at work tomorrow." Another text says she will be required to report to work or you apply the attendance policy.
A lot of our employees have tested positive, so they're staying home.
63-year-old Janie McKenzie is one of the positive patients. She has multiple sclerosis and says it can take hours before someone can help clean her after she soils herself. She wants the state to evacuate her and the rest of the residents to a hospital.
If they're licensed nurses working, and that's all that is in a hospital, so yeah, the care would be much better.
It's very sad how it all spread so quickly.
Well, the most recent inspection report available to us on Life Care Center of Elkhorn is from June 27th of 2019. Now, according to Medicare.gov, the facility received 1 star out of 5, much below average, it says. The report notes inspectors found 6 health citations in its most recent inspection. The report included some documentation errors, a medication error, and in one case for violating infection prevention and control procedures. The report says in June of last year, a registered nurse did not use hand sanitizer or wash hands before providing a resident with medication. The nurse also conducted a blood sugar test without practicing hand hygiene. Now, Medicare records indicate there had been no inspections of Life Care based on complaints between last April and March 3rd of this year. Now, we have repeatedly asked for an interview with the director of the Elkhorn facility or with someone from corporate management, but we have only received email communications.